Well, one way to seriously slash healthcare spending by investing in preventative medicine. Andrew Rubin is the vice president of the Medical Center and Clinical Affairs and Affiliates at NYU's Langone Medical Center. He's also the host of Healthcare Connect on Sirius XM Doctor Radio. You know a lot about this topic, and people like you are in demand right now because they want to know, how can we fix healthcare but do it in a way that is somewhat affordable? So let's talk about the waste. Where's the waste in the current healthcare system coming from?
Well, it's interesting. You got to put this in context. So President Obama wants a bill that's not going to cost the taxpayers any more money. So the only thing you can do is find where the waste is. Now, waste, can be found in lots of different places in the healthcare system, but I think some of the easy things to look at are obesity. $200 billion spent on taking care of obese people. Smoking. I think the numbers are in a recent study, between 190 and over $500 billion in people who smoke. So, we got to filter out all the noise in the politics and actually get down to work and start tackling some of the areas where we can save some money in the healthcare system to cover more people, because that's what this is about.
Exactly, and there's a number of proposals out there floating around Capitol Hill right now. Lawmakers in their home districts this month talking to their constituents. But in the proposals you've seen so far from the GOP and from the Democrats, what's included when we talk about prevention?
Well, first, before we even talk about the bills, President Obama, as part of the stimulus package, had $1 billion for preventive medicine wellness programs. Now people can say, what is that going to do? It's a drop in the bucket, but making people healthy and taking better care of themselves is a great start. In the bills I've seen, particularly in the Senate bill, there's $10 billion currently written into that for wellness and prevention programs. So it's a drop in the bucket, because if you're talking about $200 billion for obesity, it's going to cost more than $10 billion to make people healthy. Right. That being said, you're going to save a lot of money if you can solve 25% of the obesity problem, and you could save 25% of $200 billion. It's a lot of money.
We're talking about costs that come both to the individual, the families, households across America, and to businesses. I mean, healthcare costs and subsidizing health insurance for employees is a huge cost to businesses. What are you seeing that American businesses are doing or should be doing when it comes to both wellness programs and also just disease management?
So a recent PricewaterhouseCoopers study that just came out, where they surveyed self-insured big businesses, they're putting a lot of money into wellness programs, preventive medicine programs. Now they're a little bit skeptical about whether it's going to work, but they are putting money into it. So subsidizing gym memberships, smoking cessation programs, better eating, healthier food choices. They are putting money into that. And in fact, IBM is a recent example of a company that over 2 or 3 years invested, I think, about $80 million and saw a $190 million return on investment in terms of lower healthcare expenditures. So there's real money there, but it's sometimes it's hard to quantify.
And finally, quickly, as an individual, what can I do to cut my healthcare costs? Does this come down to not getting too much insurance that I don't need?
Well, that's a complicated question. I want to say two things about it. First of all, what's in the current legislation is they're going to basically eliminate discounts for healthy people, and that I think is a little problematic. But we'll see how that shakes out. Listen, it's always better to be healthy. You will always save money on health care if you take better care of yourself. Fewer doctor visits, less medications. Be healthy.
Go to the gym, don't smoke, eat healthy. Appreciate it, Andrew Rubin. All right, let's go forward. The credit card holders' Bill of Rights changes.